Today's health headline: September is Spinal Cord Awareness Month. The difference between spinal cord injuries and other common conditions. Should you be worried about tingling or numbness in your extremities, and how everyday life can impact your spinal cord? Joining us now is Dr. Raj Gala, Yale Medicine spine surgeon and assistant professor at Yale School of Medicine. Dr. Gala, thank you so much for joining us this morning.
Thank you for having me.
Okay, so let's start out right away with the difference between a spinal cord injury and conditions like herniated discs or sciatica.
Yeah, that's a great question. When we're talking about herniated discs or sciatica, those are much more common, and they typically will affect one nerve, maybe two nerves, and usually it's on one side of the body. Typically, those symptoms are going to be more sensory, such as pain, numbness, tingling. Spinal cord issues are a little bit more broad because they're going to affect a whole bundle of nerves, or really the big spinal cord tract that runs from our brain all the way down our spine. And those symptoms can be much more ominous. They control our dexterity, our balance, our use of our hands, and our bowel and bladder. So the symptoms, there can be overlap, but generally we're talking about a condition that's affecting one nerve versus a lot of nerves.
Okay, good to know. Now, you did talk about just now the tingling and numbness. So when people feel that in their arms or their legs, is that always a cause for concern? Or would you say there are some other warning signs when it comes to spinal cord damage that we could kind of be aware of?
Yeah, that's another great question. So tingling and numbness are actually very common in extremities, and more often they're from a peripheral issue such as carpal tunnel. We do a lot of repetitive activities in our day. People get carpal tunnel, which will lead to tingling in their hands. There's also a condition called neuropathy, which is much more common and can cause tingling in the feet. Now, the difference with spinal cord tingling is that typically that tingling will start somewhere in the spine, such as the neck or the back, and radiate down. While the other conditions I mentioned, the tingling may just be in the tips and kind of work their way up.
Oh, good to know. Okay, before we go, how can everyday habits like posture, exercise, and especially those who are sitting at their desk all day affect your spinal cord health?
Of course, we now have a condition that we call tech neck, for example. And so when we're doing a lot of things where we're hunched forward or looking down, that puts a lot of strain on our neck, which can affect our discs, which can then press on our spinal cord. And so doing activities such as chin tuck exercises, where you're bringing your neck back, and you can do that yourself even while you're working, that can relieve pressure on your spinal cord. And then for the lumbar, you should really be getting up, at least every 20 to 30 minutes and doing a little walk so that you're not sitting all the time and putting pressure on those lumbar discs.
Good little tips there to keep us, our spinal cords healthy. Dr. Raj Gala, thank you so much again for taking the time on your Friday morning.